This idea of identity-based OCD, when it comes to the fears associated with OCD, you have fears around the idea of what may happen to me. Am I going to get sick? Am I going to get injured? Am I going to feel terrible? Am I going to be rejected? Whereas identity-based themes are, what may I be? Like, who am I? And I'm afraid that I may be something that I fear. A very well-known subtype of OCD relates to gender identity. Fear that you may be in the wrong body. Fear that you might be trans.
You must be some kind of therapist.
Today I'm speaking with my friend Dr. Elliot Kaminetzky. He is a child and adolescent psychologist specializing in parenting-based interventions for child anxiety, obsessive-compulsive disorder, and behavioral challenges. He is also one of those brave therapists who has blown the whistle on the scandal known as so-called gender-affirming care. So today we're going to talk about how it's going several months after making that brave decision to blow the whistle. And we're also going to talk about his insights into what obsessive-compulsive disorder has to do with your child's gender issues, perhaps something he calls identity-based OCD. So I'm excited to talk. Elliot, welcome.
Thank you. I'm so excited to be here.
Me too. I feel like we're overdue for this conversation. You told me before we started rolling that it was okay if I let people know that I was one of the people you reached out to when you were gathering your strength for coming out with your concerns to the public. And I have to say that I'm so happy you did. And it's just been awesome to see you out there having a voice in the community and overcoming your fear. And honestly, you're quite funny on the other side of your fear.
Thank you.
Like even as I was getting ready for this appointment today, I texted you, still doing my makeup, and you said, same.
Right. Yeah. I was actually using power tools.
Power tools. Oh, wow.
Yeah, adjusting the basketball hoop. But
oh, cool.
Yeah.
Well, I'm really glad that we're here today. And, you know, I've had several episodes now where I talk to someone who blew the whistle at some point in the past and then like just check in on how that's been going for them, like with Jamie Reed and with Tamara Petsky. Tamara Pitsky.
Yeah, Tamara.
Yeah. So I know it took a lot for you to gather the strength in this current sort of political and social cultural climate to express your concerns about this issue. Can you tell people how that's been going for you since you've been public with your concerns?
Sure. Well, first, in response to, our dialogue and what led up to our dialogue, like you've been very influential for me through the whole process. I think we were both in that huge, crazy Facebook group, during the pandemic, and we're like, something is up, which I'm currently banned from.
Can we name it? Are you okay with naming it? Therapists in Private Practice.
AKA TIP. It was a place where there was only one opinion therapists were allowed to have for every topic.
Mm-hmm.
And if you had any question about anything, like everyone prefaced it with, don't pile up on me, please. And I'm so sorry for asking. And also, here's a very benign question. So it was crazy. And then I heard your story of like how you were piled up on for the very reasonable wet hair question.
The wet hair question. There were like 3 moderators in that group that were these woke bullies. And they had this rule against dirty deleting. They called it dirty deleting. So if you posted something that you thought was innocuous enough, and then you got ganged up on, and all these people piled on telling you how racist and sexist and homophobic and transphobic your question was, and how it was a reflection of cis white heteronormativity, blah, 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 blah. Like, if you got the pile on, and then it overwhelmed and frightened you, and you were like, oh, never mind, and you delete your post, the next thing that happens is you get bullied for dirty deleting because you're not ever allowed to delete anything because you need to be held accountable for your sins.
Oh my God. Yeah. For a group of therapists who use the word trauma, like every other word they say, and they're trauma-informed, trauma, they like traumatize therapists and like make them live through public shaming. It's bizarro.
You know what? I know we have a lot to talk about today, and this is not one of the topics on the agenda, but
Oh,
I
yeah,
have to share a story because this reminds
please.
me of the hazing ritual that they welcomed me to grad school with. And like I should have recognized at the time that that was a warning sign about what was going to happen to the mental health field, but I got raked over the coals as my welcoming to grad school in a similar ritual except in person. It was we were all on retreat and we did this thing called tea groups. Have you ever heard of a tea group? It's like an
I,
encounter group.
yeah, like where it was basically like group therapy mandated as part of the, yeah,
Yeah, kind of,
okay.
except the people running it were not therapists, which should have been a red flag. I mean, this is
Mm-hmm.
a therapy counseling program. All of our teachers were therapists except the tea group facilitators. They were very woke. And we divided into three groups, and it's like you have to talk about what's happening relationally in the present moment with the other people in the group, and you're not allowed to leave the room. And there was like 40 hours of this over the course of a week. I might be exaggerating slightly on the numbers, but yeah, I like said one wrong thing. And looking back, it was so innocuous. It was someone uttered some concern about racism that she was perceiving. And I said something like, I'm really sorry you feel that way. I wouldn't want for you to feel that way. Or maybe I said it like that I didn't see the thing that she was seeing or something. And I said it in the most innocent way. And then there was this like, the white lady just denied your experience of racism. Let's get her, like
Oh my
and
God.
and I had a history of childhood bullying, including over race issues. I mean, I'm the little 7-year-old Stephanie was being bullied for being white. Like, so, for I was having this like trauma response and I kept going to the instructors, like, please help, please get me out of here. This is too like I was having a meltdown because everyone was targeting me. And they saw that as evidence of my emotional immaturity. And that was my introduction to grad school back in 2010. Like, I managed to have some good experiences in grad school, but I should have seen it coming then, honestly, all this nonsense. It's just,
Yeah.
at the time, like, I felt like it was my fault.
Yeah, and I think it's kind of good that you made it through because then you were able to start your therapy career and ultimately really influence so much psychologists and mental health professionals like myself. Like I was watching your career unfold from someone who was like, getting bullied by this group of therapists, which sounds so bizarre if you think about it. Like therapists are supposed to be the nice people who totally understand like they're such bullies. Some of
Well,
them.
it's the drama triangle. It's
Yeah.
they're not always the nice people. They're the people with the savior complexes.
Yeah.
And then,
Precisely.
all you have to do is do something to trigger their heuristic, their mental shortcut to perceiving you as the persecutor. And next thing you know, you are definitely the victim.
Yeah, and I remember like you speaking out on all of the issues that so many think about but therapists aren't allowed to talk about. And I was like a little jealous. I'm like, oh, why is Stephanie able to do this? Like she's so lucky that she's actually able and has the bravery to speak her mind about like really important issues. And I would like listen to all your podcasts and like certainly about the gender issue. And ultimately, it was super helpful to join your locals community. She didn't tell me to advertise it, but it's great. And I actually consulted with her about like these current concerns that I had, and she gave me and I still had questions like struggling with this issue of true trans, for example, and what does that really mean? And she walked me through it really well, and so I got the answers I needed, and it was ultimately I remember when you were when you weren't feeling well because of the long COVID health issues you were experiencing. And I remember having this thought like, oh no, if Stephanie is out of commission, like there'll be no one left to like, resolve or like to address this issue. And then I had like this aha moment of like, what's wrong with you? like why can't that be you? Like, why can't you speak about it? And I think that's where I got the ball rolling. And like the previous excuse I had, I'm like, I have a mortgage or like, like my family or whatever, like garbage I was giving, I realized was just so that I wouldn't have to face whatever may come my way. And ultimately, like I was feeling really down and it was like, I wasn't able to sleep so well because I was just like thinking about just censoring myself all the time. And then finally you had that tweet about therapists arguing about CBT versus psychoanalysis, and you compared it to like rearranging the deck chairs on the Titanic. And I thought you were calling me out because I was part of that debate. But it turns out you weren't even referring to me. But that's when I'm like, you know what? This is the time. Like, if I'm not going to say it now, I'm not going to say it. And I just, said that whatever people are saying about this issue, almost no therapists who are well trained, who are based in research, actually believe lockstep with the things you're allowed to say. Because I had been talking, first I was talking to my safe people who I knew like also had some concerns in some way. And like then I started expanding, talking to other psychologists. And these are like head of departments, like people with over 300 publications and books under their name. And they're like, yeah, there's something up here. And then I'm like, oh, cool. Like, we're going to just expose this. And then, people are going to start approaching this with a more sober lens. And it was a little disappointing that it's not that easy. But yeah, you were like a huge part of this process and, helped me get where I am now.
Oh, well, you flatter me too much. But thank you for giving that information to other people to understand what's going on here, that there is this overwhelming amount of therapists who definitely aren't 100% on board, they're like somewhere in the middle, but the vast majority of it are just ignoring it. They're just trying to steer clear of it somehow. I mean, the thing is, like, I will say, let me take the devil's advocate position that I have permanently given up my ability to do family therapy with this population. And that really stinks because I would love to do family therapy with this population. I was a good family therapist, I like to think, and I see things in a systemic way. And so now the work I do as a parent consultant and as someone who's developing resources for parents, it's like I'm still thinking in that systemic way, and I'm looking at what parents can do to change the family dynamics, but I'm doing it as more like in the context of creating educational resources. I mean, I do appreciate the fact that there are therapists who have chosen to stay quiet in the sense that it still allows them to work with people and not be Googled, because there's a generation of people that has been brainwashed into thinking that those of us who are trying to help are out to get them, that they will be harmed by talking to someone like me.
Absolutely. And it's a problem that I experience as well. But I would say of all the people I spoke to, the amount of them who are not speaking so that they could work with this population effectively is very
That's
small.
the minority, huh?
Yeah, it's mostly people who are like, oh, I have tenure, and if I spoke about this, I would totally lose that. It's the reason of, yes, I would have to deal with the discomfort of being honest. And I think I really relate to what Jordan Peterson speaks about, like that importance of telling the truth, or at least not lying. And the gift you get for that is you go on an adventure, and life becomes an adventure because like you're actually putting yourself forward, and that's who you are. And it's been an adventure, and I've enjoyed it.
It's funny that you admitted that, I can't remember if the word you used was jealousy or envy, that you felt that toward me. I appreciate your honesty about that, because it's funny to me, because I guess the thought that first went through my head is like, that's nothing to be envious of. That's my childhood trauma. Like that's this is how I deal with stress, is that my kind of like fundamental orientation to life is there an adult in the room? Is there a competent adult in the room? Is anybody going to do? No, I'm the adult. Oh shit. Okay. Like,
I'm driving this car.
Yeah. Like, that's, if I could go back, like I'd appreciate like feeling a little bit more secure in life. But I think my courage is more like, it's like, well, somebody's got to do it. Shit, I guess it's me.
Right. Would that be post-traumatic growth, given where it's gotten
It's
you?
just character development. I think people are too quick to try to ascribe psychiatric labels to things these days, and it's because everyone's afraid of just being a little weird in their own way, but also
Yeah,
afraid of being ordinary in some ways. Like there are things that are perfectly ordinary and mundane about most people, and I think
yeah,
this generation has been conditioned to fear and loathe their ordinariness, the things about them that aren't special, the things that are just like, you want the same things everyone else wants. You want a secure relationship and a roof over your head. And so it's like people are trained to fear their ordinariness, but also to fear like just the little things that make you quirky. Like,
yeah.
and like for me, like I'm joking about it's my childhood trauma. It is my childhood trauma. Like that's true. But at the same time, like I'm okay just admitting that this is just the kind of person that I am, and maybe it's a little problematic in some ways. Like it's got its strengths and its weaknesses. The way I react to danger is like I get really hyped up and but it's just the way I am.
Yeah, I think like reflecting on what you're saying, the part that's going to be most unique about us is our ideas, our soul, like our humor. Like yes, there are these universals that are common, but like if you have to self-censor, I think you're all going to like the whole package is going to be mundane or like seen a lot of time, but to the extent that you could actually say what's on your mind, like go to ideas or like just really think and say like that's gonna be what makes you unique. It's interesting that like someone once said, I'm an Orthodox Jew, and in the more whether it's ultra Orthodox or quote unquote yeshivish world, like you'll see them all dressing the same, right? They'll all wear, let's say, their black hats, white shirt, and then someone says like, doesn't that seem like so we're like you're all just a bunch of copies from each other? And in response they said it's not our clothing that's going to make us unique, it's our mind, it's our ideas, it's our passions. And like don't get distracted by wearing a cool shirt. That's what makes you unique.
Well, I think this gets into the identity issues that we're going to talk about today when we talk about the gender stuff. And I've noticed in therapy and consulting with people who are in some kind of process of trying to sort out what is really me, what do I really think, feel, want, and believe, as opposed to the cultural influences that I've been told about what it is to be a good person. And traditionally in therapy, we're taught that a lot of that messaging comes from the family, but I think increasingly it's not so much the family, it's the culture that people are internalizing those norms from. And it gets really toxic, like when young women, for instance, are made to feel like their desire for marriage and children is like antithetical to feminism or something. I mean, there are real consequences for that. Being out of touch with their own desires, sacrificing their needs, trying to convince themselves that what they want or what's going to make them happy is, having casual sex until they're 40 and then like having to go through IVF to get pregnant because they spent 10 years in denial of the things that are actually very ordinary about them, because they were in a part of a culture that tells them these things that are ordinary about you, like the desire to love and be loved and be secure. Like that's not cool enough. It's not progressive enough, right? It's like, there are people wasting years of their life because of these toxic ideas.
Yeah, and I do think that is part of what led to the RGD situation in adolescent females, is that what, like there are differences between men and women that are real. And I guess modern Western society has really just lauded all the things that are more typical to men, like being, captains of industry or being like much stronger or things like that, while totally, mitigating and even insulting things that are anything feminine, anything that like are unique to women, right? Like seeing, I don't know, like being nourishing, raising a family. Like I know someone who's a stay-at-home mom, and when people ask her what she does, like she feels embarrassed to say it. She feels embarrassed to admit that she doesn't have a job. And she's like raising this awesome family, and she's like running her home, and it's awesome. But like in the society, like you're seen as lesser than because that's the choices you've made. So I think like identifying out of it, identifying into the man who maybe exemplifies more of these modern, like the epitome of these, whatever's emphasized now, I think really led to what we're saying.
For sure. And remembering my own adolescence, and I'm one of those people who says that I would have been one of these kids. And I think I hated my femaleness. I hated the weakness that I associated with it. I wanted to be tough. I mean, I'm sitting here making jokes in this conversation with you today about my childhood trauma, but part of that pattern was I'm the one who has to be strong, right? And strength is a quality associated with masculinity. And I was a fatherless girl without enough protection in the world. And so, of course, I despised my femaleness. I mean, my body was all wrong according to the beauty standards of the time. And that is a perennial problem. I mean, the beauty standards have changed slightly, but, the constant as far as young women are concerned is that there's always something wrong with your body. And, so I hated that vulnerability. And then I hated the emotional vulnerability that came with, not feeling protected enough in the world. And okay, but tell us about this idea of identity-based OCD.
When it comes to OCD, there's a lot of terms for the different subtypes and different categories of the subtypes, right? So we'll hear about, contamination OCD. We'll hear about, symmetry-related OCD. And I think a helpful categorical term that I've been toying around with, I actually Googled it. I think it's been used a few times, so I'm not the first person to say the following words. But this idea of identity-based OCD is, when it comes to the fears associated with OCD, you have fears around the idea of what may happen to me, right? Am I going to get sick? Am I going to get injured? Am I going to feel terrible? Am I going to be rejected? Whereas identity-based themes are, what may I be? Like, who am I? And I'm afraid that I may be something that I fear, right? So, yeah. So this idea, so you'll have what used to be called HOCD, like homosexuality OCD, which got renamed to sexual orientation OCD. But this idea of like you have someone who is straight, like heterosexual, he may be married, and then he gets this thought, like he walks down the street and sees like a good looking guy, and he's like, oh, what did that mean, right? You have this intrusive thought of like, what if I'm gay? And for like a married guy with kids, let's say in a Catholic community, that's a very scary thought. Included in this is, what if I'm a bad person? So that would be like more in the moral scrupulosity category. So what does it mean to be a good person or a bad person? So like, let's say they'll just be having a regular conversation, and then they'll go home and they're like, did I insult that person? Okay, what would be so bad if you insult? Well, if I insult people, like, I'm a bad person, and that would be like terrible. So they may do like a half an hour of mental review, like running through that whole conversation, thinking about all the facial expressions and whether or not they were insulted, asking other people who were part of that, conversation, whether or not you may have said something, and then maybe calling back again and asking if they're sure you didn't say something. So that's like all part of like the compulsive rumination. But at its core, it's like I am afraid I may be something, right? At its core, and I'm doing all these compulsions to make sure I am not that. So a very well-known form, a subtype of OCD, relates to gender identity. like fear that, you may be in the wrong body, fear that you might be trans and not cis, right? As they would say. So, they'll like if you go to whether it's the Reddit, you'll see these themes emerge very commonly of like, I went, I was walking past this store and I saw my reflection, and from the reflection I looked kind of feminine, and then I thought I might have liked that. Does that mean I'm really trans? Right? So, and then they'll be like, they'll have their tests to make sure you're not. And, they'll be like, oh, but what if that test is wrong? So like, it's very hard to logic your way out of OCD. So this idea of identity-based OCD, like I said, has to do with that fear of who may I be? And to help that, I think it's helpful to conceptualize identities in terms of social constructs, right? Kind of like, what does it mean to be a good person? Probably varies based on the society you're in. Like maybe in one society it means giving a ton of charity, and I don't know, in another society it means you do land acknowledgements before you say anything, right? So I think understanding identity in terms of a social construct could be very helpful. And social constructs doesn't mean they're not real per se, but that, there's no consensus as what it means to be that particular identity. And it can be very empowering for you to be able to choose the standards by which you could be a particular identity that you want to be. What does it mean to be smart, right? Like you decide what it means to be smart. And I think there's value in realizing these are not objective things, our identities, and people will have different standards, and you decide what works for you.
Today's sponsor, Cozy Earth, is offering my listeners 40% off their selection of luxurious bedding, bath sheets, lounge apparel, and skincare products. Transform your space into a sanctuary of serenity and renewal. Check out their best-selling bamboo sheet set and plush luxe bath sheets. Visit cozyearth.com/sometherapist and use promo code SOMETherapist to take 40% off your purchase. If you get a post-purchase survey, say that you heard about Cozy Earth from this podcast and they'll send you a free set of socks. All right, now back to the show. Okay, so when you were talking about identity-based OCD just now, you said someone gets the thought, am I trans? And there's fear around what I could be, and you sort of made it analogous to this idea of the heterosexual man with the intrusive thought, what if I'm gay? And then he becomes so obsessed with this intrusive thought that it becomes impossible to know that, no, he's still a heterosexual man who just noticed that another man was a good-looking guy for a moment, and that this man has OCD. So there's a reaction. And maybe you could explain that a little bit more about like what happens in a person with OCD when they get an intrusive thought, and how to tell what's real and what's intrusive. But there's something that was occurring to me when you said that about the idea of being trans, which is that what if it's the other way around? What if the fear is this fear of being ordinary, right? Because there's this culture around social justice and oppression and all of this stuff, right? And a lot of the people who are falling into this are ordinary people, or they would be ordinary, So when I give myself as an example, I'm a pretty quirky person, but the thing that makes me special is not my gender or sexual identity, right? And yet, I think as a young person, I experimented with those outward signs of difference, because that's what you do when you don't have that sense of identity. Like you were saying, for instance, with the men in the Jewish community, they all dress the same because they recognize that what makes them unique is their intellect and their spirit, right? So as a young person, I dyed my hair every color of the rainbow. I experimented a lot with my look. I was a punk. I was a raver. I was a hippie. I was, and like that's all normal adolescent experimentation, because that's what you do when you don't have a strong sense of self yet. That those are things that you use to scaffold a sense of self. So I'm thinking, here are all these young people who don't know what makes them special or unique. They haven't had enough life experience yet, and they have a lot undermining their sense of self. So, for example, the pandemic lockdowns interfered with them having certain life experiences that would have built a sense of identity through meaningful experiences with other people and out there in the world, right? Then you have the social justice climate that tells people that you're an oppressor, and there's all this stuff. So to me, it seems like maybe for some young people, it actually starts with the need to feel that there is something special or unique about me, or that at least I'm not one of the bad people, right? So we're looking at, you talked about like, am I a bad person? And you have adolescence, this like moral rigidity, this black and white thinking. I want to make sure I'm at least not one of the bad people. And so then I wonder, for some people, it's not, am I trans? Oh no, I might be trans. Oh no, I might be trans. I think it's this fear that I'm just another cishet white kid, or cishet whatever kid. I mean, they're not all white, but a lot of them are, and a lot of them are middle class, right? But it's this fear of being ordinary, this fear that I actually don't have this thing that makes me special and unique, and actually the things that are quirky about me, I'm going to have to find some other explanation, or I'm just going to have to own them. Like I was saying earlier, right? Like I just have to own that I'm a little intense sometimes, right? And I could claim a label, I could claim a psychiatric excuse for my intensity, or I could just say I'm intense and I'm weird and I'm not everybody's cup of tea, and that takes courage. And I don't think a lot of young people necessarily have that courage to just be like, this is me, I'm just weird. It's not my sexuality or my gender identity that makes me weird. It's just I'm an awkward teenager, and I'm one day going to develop into an interesting person, but I don't know who I am yet.
Yeah, well, there could be like, you have like the more superficial fears, and then you have kind of the core fears. And this like one superficial fear of like, what if I'm trans, could be related to two separate core fears. When it comes to individuals who fear they may be trans, very often the core fear is, what if I'm living inauthentically, right? So you'll see a lot of, trans influencers talking about, finally living their true selves and never being happier in their life, right? So, even like Jack Turbin will write like, imagine living your life as truly you, right? So think about that. So you have someone who's just like, a person, and they have their bad days and their good days, and they have their friends and they have their problems. And then they see like this idea of living your true self and never being happier. And I think that's so alluring. And then they have a situation where like they really wonder, they saw their reflection and they're like, oh, I look feminine and I kind of like that. They're like, uh-oh, what if I'm trans? I'm just living my whole life in the wrong body, when I could really be happy. But if I'm not trans and I medicalize, then, that would also be bad, right? So I think like that could be one form of core fear when it comes to trans-related OCD. Alternatively, like you were saying, I think that fear of being basic. Now it's like this insult, like calling someone a basic something, right? I think that could manifest in, how can I make myself stand out? How could, so the sense I get when it comes to that OCD element to it, I often find that it's based in this fear of living inauthentically, and kind of like pining for this true happiness that can only come from living the right way.
That's such a good point. I was really, really appreciating the sort of granular detail you got into there with what might be going on in the psyches of some of the people with this affliction. And it resonates. I think we're both bringing up valid points here. Like there's the, what if I'm trans? What if I'm not living authentically? Right? I think that's a path for some people. I think this other thing that I articulated is also a path for some people of, well, I don't want to be cis. I don't want to be cis. I don't want to be cis, right? So, but for the I love the way that you broke that down. This, like, I'm afraid that I'm living inauthentically. And I've been introduced to this idea that some people have this trans experience and they realize that that's what was holding them back from being authentic. Like, I've seen, because in my parent consulting work, sometimes parents show me like texts or email exchanges with their kids, and I get to read their kids' own words, or I get to look at their social media posts and I see, and it gives me so much insight into what's going on in their minds. And I've seen exactly what you're describing. It's this, like, this story that a person has concocted about their experiences of like how it all adds up, right? That I haven't been living for myself. I haven't been authentic. And it's like, I believe there's something true in there. Like, and if we're going to be effective at helping parents restore connection and understanding with their kids, they're going to have to, in some cases, find a way to reach this part of the kid that's saying, I don't feel like I know who I am, or I don't feel like I've been living for myself. And so then it's like, we look at how else could that be true, right? So like with, I'm thinking of a family where we looked at how the kid always felt a lot of pressure to perform academically, and that maybe in the process they lost some other aspects of the process of getting in touch with themselves. And so now they're pinning the whole thing on this trans idea.
Right. And I think like OCD, like it's like a more extreme form of like a very reasonable fear that many people have. And also, it's based on something that's very important to them. And like adolescents, like being authentic is like the most important thing to them, right? Like you want to be your true self and you're like authentic. And, so I think, you could have like a very, like a very reasonable fear, but like when the OCD takes hold to it, it becomes like, now I'm going to check the mirror every day to, sometimes dress more feminine, other times more masculine, and see like when I'm happier, right? Or I'm going to check and recheck. I'm going to ask my friends like whether they think I'm more trans or more cis, because it's like I want total certainty about something that's genuinely important to me. Just like, those who have contamination OCD like really want to be healthy and not sick, right? But it's like OCD takes it, hijacks it, and it becomes, all about gaining total 100% certainty. And that's where it becomes pathological and maladaptive. And I think different ways we view our identity, like there are maladaptive beliefs about identity that kind of get people stuck. And I think part of it is this idea of objectivity, like that there's this objective, like almost material biological truth that is trans. And your goal is to know whether or not you are almost like a blood type. Am I cis blood type or trans blood type? Right? If I'm a trans blood type living as a cisgender person, like, I'm wasting my whole life. Right? So this idea of, and that's kind of what's being, fed to these people is like, it's almost like a blood type and you have to know who you are, when it is a social construct, right? We as a society kind of agree that there's this term, and what does it mean to be that, right? And even that evolves over time. What does it mean to be trans? And does it mean someone who has transitioned? Does it mean someone who has gender dysphoria, right? I mean, it used to be more about dysphoria, but then they're like, you don't need to have gender dysphoria to be trans. You just have to know, right? Which is like, what does that mean? Right? Like we're like, so that could be like a really maladaptive belief for individuals with this form of OCD, because then they're just on this mission to know the truth. And that's even similar to like your sexuality. And I gave a talk about this recently for Therapy First, and I brought up this article called like Bud Sex. And it's basically like men who identify as straight and they just like to have sex with men. And the reason why, like just some friends, they could be married, have kids, conservative, and they're just like, sometimes me and Jim like to have sex, but that doesn't make me gay because Jim's not gay, right? Like they almost, for them, right, in their society, among their group, homosexuality is more about femininity versus masculinity. right? So there you have someone who has, totally comfortable with their sexuality and will just say like, yeah, I'm straight, but, sometimes I have sex with men. Whereas someone could be like really heterosexual, but the fact that they found one guy slightly attractive, suddenly they are hyper concerned of what that may mean, right? So even something like sexuality is determined by your culture, and it is subjective. And I think empowering people to determine what standards do they want to use to assume the identity that they want to be, recognizing it's subjective. Does this identity work for you? Is it meaningful to you? So I think that's really important to kind of correct the maladaptive beliefs around their identity and their thoughts about identity.
So we're going to back up a second and just spell out some things about OCD for those who maybe don't have a background in this. I did do an episode with Johan D'Souza where he explained how OCD works, but some of the things you have said, I think it'd be really helpful for listeners to understand just the OCD mind and this idea of an intrusive thought and, how is it that an obsession or a compulsion develops?
Sure. Right. So like you said, OCD stands for Obsessive-Compulsive Disorder. Obsessions are recurrent, intrusive, unwanted thoughts, images, impulses, and compulsions are repetitive behaviors or very commonly thoughts meant to reduce the distress caused by the obsessions, right? And that could have a lot of different surface, right? So that's the structure of it, and it becomes a disorder when the frequency, intensity, and duration of these obsessions and compulsions are so much that they're causing severe distress and functional impairment. And it could be extreme distress, like there's a high suicide rate among individuals with OCD. So, I think there's a lot of these very common media portrayals of OCD just being about, concerns about cleanliness or being very, very neat, when in reality, most often it's about just these intrusive, scary thoughts of like you're making salad and you're cutting with a knife and you just have this image of thrusting that knife into your chest, like extremely violent and scary. That would be like harm OCD. And you could have a person who's like not suicidal at all. And what's so scary about it is that they could end their life with a simple move of their hand. They could end their life. Or if they're like going on a hike and they see to their right, like there's a long way down, like what if I jump? Right. So that's the obsession, like that. What if? Right. And people without OCD might be like, that would be crazy if I jumped off. I'm not going to do that. And they'll go along their way and eat their trail mix. And, or they'll continue chopping their salad. And, if you have OCD, it's the appraisal of that thought as something that's meaningful and something that I need to address. So they'll be engaged in compulsions. So it might just be hypervigilant, like they might cut very slowly and make absolutely sure that they're not, going to stab themselves. They may think about that day and whether or not they had any depressive thoughts, thinking that, that would make them much more likely to stab themselves. They may, lock away all knives and will cut salad with a little plastic knife, right? So the outward behavior of individuals with OCD could vary significantly for the same fear. And this could be very disabling. And, it's a really, really challenging disorder. And luckily, there's treatments that work for it, such as exposure and response prevention is what I focus on among other treatments.
Thank you for spelling that out so clearly. You just differentiated that it's the appraisal of the thought. Like that we all have thousands of thoughts a day, and some of those thoughts might feel intrusive or misaligned with our character, our intentions, our motives. And that a person without OCD just sort of dismisses, well, that was a weird thought. I would never do that, right? But it's a person with OCD attributes a certain amount of meaning to that thought. Like it tells them something about who they are or something of that sort. You know what's coming to mind? Have you seen this Netflix show, The Decameron?
I haven't.
It's so good. If you like dark
Cameron?
humor, The Decameron, it's like, so it's a medieval show, but it's
Okay.
dark humor. It's really funny, but also there's a lot of death and gore.
I'm going to totally see it. I love
It's
dark humor.
it's so funny and also really dark. But
Okay, good.
one of the characters is this zealous young religious woman. And of course, it's taking place in the 14th century. So, religion is everything, and plagues are caused by demons, and, everything is evil spirits. And so there's this young woman who she keeps having intrusive thoughts about sex because she's young and fertile, and she's married to a man who's secretly gay. And so they have a vow of abstinence, which on the surface is supposed to be about her love of God, her chastity, right? But really it's that he doesn't want to have sex with her because he's gay. And meanwhile, she's not all that attracted to him anyway, but she keeps like lusting after random attractive men, and she's incredibly pious. And so she spontaneously drops to her knees and starts praying really fervently throughout the show. Like anytime, anything about the plague comes up, because it takes place during the plague, but it's also, you could clearly see it's a reaction to her intrusive thoughts. It's that, so like she obsessively goes to the priest and confesses her sins, her sin of lustful thoughts, and it's very like entertaining depiction. But it was just like, I was connecting those dots. I was like, oh yeah, this is actually like a form of OCD that's being depicted, because this woman is afraid of her thoughts. She's afraid that her natural attraction to men is, basically the work of the devil, and the plague is also the work of the devil. And so that, the neutralizing ritual is praying, 20 times a day in response to everything.
Yeah, and that's what you'll see today as well.
How does that manifest today in people who, let's say, for whom it's not religious? Are there things that are sort of akin to prayer rituals that people do?
Yeah, absolutely. Similar to what I said about the case of like, what if I insulted someone? Some people will be like, what if I got the wrong amount of change, or I paid the wrong amount of money? May like take a subway back to the store and like double check the prices on everything, double check that no extra money was, that I didn't underpay for something. So, there is morality outside of religion. So whatever your moral code is, people could obsess over whether or not, or I should say compulsively ruminate about whether or not they violated their moral standards. So maybe instead of confession, they'll confess to their friends, right? Instead of a booth, they'll have like saying like, I think I did this. Am I a bad person? Or like, how do I know I didn't insult someone? Things like that.
Do you think that therapy, let's say with someone who's not been diagnosed with OCD, right? And because like I'm not an OCD specialist, and I think I've probably I've probably had patients with mild OCD that didn't have a previous diagnosis of OCD, and where I missed that, and I'm just, recalling past instances where one dynamic that sometimes plays out in therapy is that the therapist is also kind of treated like the priest that the person goes to confess to in order to neutralize their sins, or as the authority figure who deems whether what that person did is acceptable or not, right? Because sometimes patients come to us as therapists looking for our approval or our condemnation, our judgment of them. And, when I've seen that dynamic play out in therapy, I usually address it relationally. Like, it seems like you really want me to be this authority figure in your life, and that, maybe that is taking the place of the way that a certain parent acted when you were young, or the role that you were told God should play. And it seems like there's kind of this theme in your life around authority. And then you bring that to me, and you're looking to me to be the ultimate authority on whether your actions were correct or incorrect or something like that. But do you really imagine that? I mean, first of all, that I have that power, that anybody has that power. And do you imagine that that would actually truly alleviate your anxiety? Because it seems like the anxiety sort of has this endless nature to it. And, might it be a better use of your energy, rather than looking to me or looking to anyone to approve or disapprove of you and your actions, to kind of look for that authority within. And what's the fear of looking for that authority within? But thinking about that same relational dynamic in therapy, I'm wondering, like, when I have experienced that, was that maybe some like mild OCD that I didn't catch?
Yeah, I think if it were OCD to the point where it would be useful to treat it for, for being OCD, like even after you had that relational discussion, like they may totally ignore you and say like, okay, fine, let's just discuss whether or not what I did was wrong. And then you can be like, okay, fine, everyone does that. I do that regularly. You're fine. And then like another minute later, but like, how do you know for sure though? Like, let me describe it to you a little clearer, right? I think if you have this like meaningful relational discussion and it sits with them and they reflect on it, and they, I think like maybe it wouldn't be OCD, right? Like, but I think, usually when it's OCD, like kind of pops out at you and you're like, what? Like, this seems like you're not hearing what I'm saying, or like
I
it's just
have
not
had
sinking
that.
in.
I have had that with a patient where no matter how many times we had that conversation of, what makes my judgment of your actions or your thoughts any more relevant than your own judgment or anyone else's judgment? Like it, am I your mother? Am I God? Like what's being projected here? Because I'm just a person, like my expertise is mental health, not moral authority. Like no matter how many times I had that conversation and talked about like, what do you imagine it would be like to find within yourself a part of you that could tell you whether that was okay or not okay? Every week, the same conversation, and I remember
Yeah.
the patient almost developing a sense of self-effacing humor about it. Like, I know I'm going to do this to you again, Stephanie. I'm going to put you in this position again where I'm going to demand that you tell me whether what I did was right or wrong. And I'm
Right.
like, I'm not going to do that for you, right?
Yeah.
Like,
So you were doing a technique an OCD therapist would do, like, exposure and response prevention. The response prevention is not engaging in the compulsion. So let's say the compulsion was to ask, but you weren't accommodating her and giving her the reassurance she was seeking. So you were helping her with response prevention and not giving her that information. And what you were saying about helping her trust herself is an important outcome of OCD therapy, most explicitly in an increasingly popular form of therapy called inference-based cognitive behavioral therapy, or ICBT, where you're not like really trusting your senses. And in the course of therapy, like really the end goal is to learn to trust yourself, right? As someone who, using your five senses and common sense, like you have what you need to make decisions.
how would a therapist guide a patient through that process?
So there's this idea of OCD being part of inferential confusion, like kind of like you're in a bubble. And it's based in this idea of a feared self. Like everyone has a certain self that they're afraid that they may be. And so like I am afraid I might be a very irresponsible person, and therefore their OCD will manifest in like, what if I leave? What if I like drop something and someone slips over it and dies, right? Like the hyper responsibility. So recognizing like you take chances, like the chances of that is like near zero, and you accept that uncertainty in every other aspect of your life, right? But for this one thing related to your feared self, you have these standards that are totally, inconsistent. So helping them realize that and helping them identify when they get stuck in like that bubble where they're no longer using their senses, including common sense, and then helping them, get out of that. In exposure and response prevention, you help them purposefully do the things they're afraid of, right? Purposefully dropping like little things on the street, and then, accepting that uncertainty of what may happen and kind of realizing your life goes on. And then you don't have to respond to these thoughts in such a maladaptive way. Like you could withstand that uncertainty. People don't just slip and die because you left your gum wrapper on the floor. And they learn to accept that uncertainty. And then ultimately in that process, they do begin to trust themselves more because they're not taking those intrusive questioning of themselves seriously, right? They'll just take it as part of the noise.
Are you looking to launch a podcast, but find yourself overwhelmed by the technical details? Or perhaps you've already gotten started podcasting, but you struggle to keep up with the parts that aren't fun? Well, my very own podcast producer can help. Nick can provide whichever services you need in order to focus on what matters most, your content. Whichever parts of the production process you find daunting, he can help you strategize or take them off your shoulders altogether. Whether your podcast includes video or just audio, whether you need someone to write your show notes and make clips for social media, or you just want your sound cleaned up a bit, Nick is your all-in-one podcast partner. His end-to-end service adapts to your unique needs, ensuring your podcast looks and sounds professional and polished. Let him sweat the technical details so you can relax behind the mic. Visit podsbynick.com to set up a free discovery call. Mention Some Therapist to receive 20% off your first month of service. Pods by Nick. Podcasting simplified. Do you ever get patients get frustrated with you because you're essentially telling them the way out is the way through, right? That I mean, it's kind of like pain reprocessing therapy in a way where you're like, you got to feel it to heal it. You're telling them that there's no magic cure for OCD. Instead, what you need to do is just do the thing you're afraid of and then keep notching it up until you've neutralized the fear and it doesn't have that power over you anymore. I can imagine as someone with OCD that I may be like, doctor, tell me something more magical than that.
Right. That's a great question. I think by the time they see me, having, have a lot of specialty in it, like they generally know what OCD is and know the treatment. And it's like, let's do it right this time. So I feel like maybe if they were totally unfamiliar with it, then that could be harder. I used to have a form of OCD called sensory-motor OCD, which is like it's not like very standard, but it's like hyper focus on like one particular thing, such as like a bodily process, such as, swallowing or blinking or breathing. And just like, these are things that are supposed to be in the background. And then like, why am I noticing it? And it could like drive you absolutely crazy. And, I got past that, thankfully. And I think in doing so, I really understood what acceptance meant and didn't mean. Because like everyone's like, yeah, you have to accept that sometimes you'll notice it more, sometimes you have to notice it less, and like go on. But it could drive you totally crazy that you're like, it could destroy your focus. It could make you feel like, oh, I'm going to, feel this way forever. So how could I possibly accept this? Right? So they're like, okay, 1, 2, 3, I'm going to accept it. Like, I didn't accept it. I'm accepting things wrong. So I think acceptance, the challenge with acceptance very often is that when we say we're accepting, what we're really doing is we're saying like, I want to feel comfortable, right? So I'm going to accept discomfort so I could be uncomfortable. And that doesn't, I feel like that cancels itself out because your real desire is comfort. And you're not accepting the discomfort because it's uncomfortable. And you're just trying to accept as another means of getting comfort. And I think what true acceptance it needs to be is you're accepting discomfort for the sake of something else. And sometimes I use the analogy of like a twisted ankle getting to, you have your best friend's wedding and you're like you need to catch your flight and you twisted your ankle. Like, I think like when you say, okay, I need to catch my flight and I realize this is very, very painful, but it's worth the pain because it's so important for me to get to my best friend's wedding and I'm not going to miss it. And I think that's what acceptance looks like. There has to be something honestly bigger than the comfort, than your desire for comfort, that's worth it to, to experience that discomfort. And, I think it's that kind of got me into like existentialism, realize like it's not just about values, like I value being a good family man or value, giving charity, but like you have a specific mission here in the world that only you could do, that has to do with your history and who you are as a person and the problems that you're sensitive to. And if you really focus on that and you identify what your mission is, then acceptance becomes meaningful because you have something to actually accept for.
That is such a good point. And, it makes me think of how I would guess, of course, I'm not an OCD expert, but just having seen people with high levels of neuroticism, your world tends to shrink, right? I've worked with plenty of people who are agoraphobic or, somewhere on that OCD spectrum, because I think phobias and OCD have a lot in common. OCD has a lot in common with certain levels of neurotic anxiety, right? And whenever I see that, it's like the person's world shrinks. And I know exactly what you're talking about when you say like that like you have to play mind tricks on yourself to convince yourself that accepting discomfort is a good idea when actually what you want is comfort. Like there's just this cognitive dissonance where you're kind of shooting yourself in the foot and it's just like moving in both directions at the same time, not really getting anywhere. But if you have some bigger motivation that makes it worthwhile to accept the discomfort, and like we can tie it into whistleblowing, right? Like you and I aren't here trying to tell everyone, join us in the whistleblowing party. It'll be fun. Like, we're not saying that your life will be free of problems. Like it's hard. It's stressful. It cost me my health in a number of ways. And I we haven't gotten into exactly what you had to sacrifice, but I'm sure there were some really scary moments where I felt like you were taking a leap. But we do it for a higher purpose. We do it because there's something more important than our personal comfort. And
Yeah.
I can imagine that maybe the thing that gets in the way for some people with OCD would be that their world is shrunk so small because of their neurosis that they've lost touch with what does make things worthwhile.
That's 100% it. And I think that's the biggest price the OCD costs is it takes you away, or it could take you away from who you want to be. And, we only have a couple of years here, right? We don't have a lot of time in the world. And I think like when we're really brought down by the discomfort, and it's real, and I don't judge anyone for losing sight of that. And also recognizing the value and the convalescent capacity that finding your purpose in the world has, is a gift that they too can be a part of, even with, getting obsessions, right? And, getting intrusive thoughts and dealing with that. And I think I think that's really a key for a lot of OCDs. I just realized that with the sensory motor experiences.
Kind of reminds me of that saying, if you want to get something done, ask a busy person. And it also reminds me of the times that because I've had a number of guests who this was their first or second or third time being on a podcast and they were pretty anxious. And I remember what that felt like because there was a first and a second and a third for me too. And, sometimes those are the ones who are, I appreciate them very much for their bravery in coming forward, but they also need the most like tending of their feelings of self-consciousness and self-scrutiny. And, oh, did I sound right? Did I look okay? Can we do that over? Like, and at some point I just have to say, like, I'm pushing you off into the deep end and you're just going to swim because I can't coddle all of your worries as a first or second time podcaster about exactly how you looked and sounded. You just have to trust the process. We're going to make you sound good enough. And I found myself saying to someone recently who had that fear, that in my experience as a podcaster, you just have to keep doing it. because once your stuff is out there, it's out there. And if you guys all think that I actually think I look and sound good all the time, and that's what's fueling this podcast, no, like I am just as human as anyone else. Like, I think I look and sound ridiculous just as much as anyone else. But I've recognized that the value that my podcast brings the world, despite its critics, despite the people who don't want to listen, I get enough good feedback about the good that is coming, even from those episodes where I think I looked or sounded ridiculous, that I've just had to get over myself. And so
Yeah.
I end up saying the
Acceptance
same
for the sake
things,
of something.
to those little, to those guests who are so afraid because it's their first or second time and they're worried about how they sounded. And, at some point it's like, it's not about you. Like, yes, it's about
Right.
you. Yes, you're sharing your life experience or your wisdom on my podcast. But at the same time, no matter what your inner critic thinks of you, some listener is getting something completely different out of that episode. And so podcasting is it's like a type of exposure therapy. There's definitely
It
times that
is.
I go back and
You
listen
are
to
an
myself.
exposure therapist.
I'm like, I don't want to listen to my own voice right now. Like,
Right.
or, but it's just like, you just have to get over yourself. And having a podcast is just, your stuff is out there in the world and it'd be very inconvenient to take it down. So yeah, anyone who's got a little bit of OCD, like, just go on like 5 or 10 podcasts and,
Maybe, yeah.
you will hate the way you look and sound. And then at some point you'll just be forced to get over it because you gave someone the right to publish the way you look and sound. And it's not about you
And
anymore.
do you trust yourself more now in the process that, like, I kind of got this and those concerns aren't?
I do. I mean, I've done
Yeah.
well over 100 long form interviews now. And I'm now at the point where I can actually record solo. I'm actually, working on a course that's going to be released this fall where I've recorded solo. And you know what I've learned? I mean, first of all, software makes it so easy. What I do is I just pause. Like, I will say a sentence or even half a sentence. And I'll just pause for as long as it takes to collect my thoughts or collect my breath, because I just have to push a button to remove all the pauses in the post-production for the video series. So, or I'll just, talk and then I'll say erase. And then that flags it for me to go and erase it. Because with the course I'm working on, I'm doing all my own editing. This podcast is professionally edited, but I didn't have time for that with the course. So,
Got it.
Exposure therapy. You just have to, just think of something bigger than yourself, right?
Yeah. That's exactly it. And you don't even need to be a CBT exposure therapist to do it, right? Like, there is something you want and there's something in the way, and you got to move towards what you want. And that thing that's in the way will make you uncomfortable until it doesn't.
I did want to make sure I picked your brain about this one thing before we go. And I think I did ask Johan D'Souza something similar, but I want your perspective because as someone without particular expertise in OCD, I have this sort of working model for what I think is going on, because a lot of the youth of the parents who consult with me do either have a prior diagnosis of OCD before the gender stuff came up, or they have behaviors that sound pretty OCD around the gender stuff. So I had this lesson in my course called Neuroplasticity, Addiction, and OCD. Maybe not in that order. And I sort of explained the 3 concepts all together, and I'm not going to try to recreate that right now. But in short, the way I think about it is like this, and I just want to know, as an actual OCD specialist, where you think my model is accurate or inaccurate. So it's that, like with addiction, let's take a common addiction like food addiction in somebody with binge eating disorder or obesity, right? Like, food is a thing that they turn to for comfort in response to a distressing emotion. And the more this continues, the more food is the response to everything. Even happiness is celebrated with food. Any emotion, any life experience, it's just the go-to is the food or the substance of choice, whatever the addictive behavior is. And the way I think about it is the more you do that, the less you're leaning on any other appropriate response or coping mechanism, the more you are sort of cementing the neural pathways of everything leading to the behavior, and you're atrophying or failing to build the neural pathways of any other response to those emotions or stressors. So then it's like, it's like water rolling down a hill, carving out channels where every time a new experience happens, it's just more and more likely to follow this predictable path. So that's how I think about addiction, for example. And then I think of OCD as I think of like gender-related OCD. this idea that I'm trans, or the behaviors around pursuing social or medical transition, and some of these behaviors are like staring in the mirror. Like I've heard of stories of like young women like putting mascara on the like soft little hairs that grow where our mustache area is, like trying to like paint a mustache on themselves. There's just so many little obsessive behaviors that these young people are doing in their rooms by themselves. And so I think that there's some kind of distressing life experience, some kind of anxiety or uncertainty or shame or whatever. And then the thought, I'm trans, and the thought of I'm going to move toward transition in whatever number of ways gives some kind of comfort or relief or distraction or hope in the moment. And then the same thing happens as with, any other kind of addiction, where the more they go towards those particular thoughts and those particular actions for comfort, the more they're sort of carving those neural pathways deeper, so that it's more likely that everything's going to lead in that direction. And the more they're failing to build other ways of interpreting and responding to those emotions and life experiences. And then something happens after thousands of iterations of these obsessive and compulsive patterns on a micro level. Something happens like a waitress using that person's preferred pronouns, saying sir or ma'am in a way that the person likes. And then they get this so-called euphoria, right? They get this like, oh my God, I feel so wonderful. I just got recognized for my proper gender. And to them, it's confirmation. The fact that they feel this elation is like confirmation that they're correct about their gender identity and that this is truly what's going to make them happy. Whereas my interpretation of that is there's a significant amount of placebo effect going on, and that they've primed themselves through these obsessive compulsive patterns. They've primed themselves to think this is what's going to make me happy. So it's actually a testament to the power of their own brain, the power of their beliefs to shape their experience, but then everything ends up getting fed back into this feedback loop. So that's my working model on how all of this fits together, and I just want to know what you think of it.
It sounds right. I think there's overlap with like body dysmorphia, where you have like a perceived flaw, right? And you notice it and it causes extreme distress, right? And what do you do to alleviate that distress? Let's say you'll camouflage it, right? Which temporarily reduces that distress, but kind of builds that connection of stimulus response of perceived flaw, distress, and then reduction of distress through camouflage.
Like binding or baggy clothes.
Yeah. Oh, totally. I think yeah, there is certainly the bones of OCD and BDD. Like you do see it, like with the distress you feel when you are misgendered, and the elation you feel when you're gendered the way you want to be, the pronouns you get. I think it's very hard to watch people who are experiencing that to have that degree of sensitivity to the behaviors of other people. It really gives away your power to just, to let people say what they want to say, and I'm going to live my life. Like I think you really, like, so much power is given up when they're told that, this is like a real aggression and a human rights violation. So I think the model is like does overlap with OCD, particularly in the negative and the positive reinforcement. And the brain is plastic, and those throughout your whole life, you're pruning and you're creating those synaptic connections, and you're reinforcing the ones that work. And it does get heavily entrenched to like everything masculine causing, positive reinforcement, anything feminine causing negative reinforcement, and removing negative reinforcement.
And that last part you said is especially a trip when there's reason to believe that the individual's underlying temperament is actually gender typical. Because I hear a lot of these stories of, boys who are very boyish or girls who are very girly prior to rapid onset gender dysphoria. and then they go fighting their nature. They go like girls who are always obsessed with looking pretty, and then suddenly they're cutting their hair short and binding and wearing baggy clothes, and they just get more and more distressed. And I think it's because this thought has entered their brain that this is who they are, because it's a cope for something. But now they're fighting their own nature too. Like they're denying, like the girl is denying that actually feeling pretty is important for her. I don't know. There's so many layers to it. But while you mentioned body dysmorphic disorder, before we wrap up, I'm glad you brought that up, because I know BDD is considered like maybe a subtype of OCD. And I've been wondering how useful it might be in some families for them to reframe their kids' issues as just another form of body dysmorphia.
Yeah, I think the real challenge is that oftentimes the parents are no longer seen as the experts in the room, right? So they're given this information that if they say it's BDD, they don't understand, right? Or, so I feel like so much of the parental responses are, filtered through the sources they find most reliable, like on Discord or anything else. And I think really the environmental change, I think, is very important, because that behavioral reinforcement schedule works in a particular context for the child. In these ROGD cases, like whether it's their peer group or their online world, right? It's working for them. And I just have to deal with my parent while I still have to deal with them. But I think environmental change, like helping expose an individual or how can I put this? Kind of bringing a new context where kind of the identity is less important, where it's not as reinforced, could be very valuable. And I think like the more I'm learning about trans and trans identity, you realize how different the presentations are. Like whether it's, males or females, whether there's the extent to which it's a social component versus a sexual component, the reasons why they got in there, and will really predict what's going to be most helpful for resolving dysphoria and for, not engaging in medical procedures that don't have evidence behind them that they help with gender dysphoria even, or help with, your mental health, right? So, I think that's important.
And it feels like we're just on the cusp of some cultural changes regarding this incredibly irresponsible, dangerous narrative, right? That people are at higher risk of suicide if they're not affirmed, when we know the opposite is true. I know there's been some recent changes in the UK that are very much welcome. So it feels like here in the US, hopefully we're really on the cusp of dismantling this really harmful way of speaking to impressionable young people as any kind of acceptable norm in the mental health field. So, Dr. Elliot Kaminetzky, thank you so much for the work that you're doing. I'm really glad that you've decided to come out and be a voice in the community. Also glad that you've started offering parent consulting. So why don't you go ahead and tell people where they can find you and what services you offer?
Sure. So I have a OCD and related disorder practice across a lifespan called My OCD Care.com. So I'm Elliot at myocdcare.com. I have I have the Center for Child Behavioral Health. So it's childbehavioralhealth.com, which is child therapy very much focused on empowering parents to help their own children. And then I have Serenity Parent Consulting for all consulting, both for private practice and also for parenting through the unique challenges that parents face today.
And as far as therapy goes, you're licensed in New York, correct?
New York, New Jersey, and soon to be Florida. And then hopefully I'll get PsyPacted so that I could see people.
Nice. Oh man, I just
in
had
half the states.
Request from New Jersey the other day, and I wish I'd known that you were going to try to have to remember who that is and follow up with them. Okay. Well, thank you so much for joining me, Elliot. It's been a pleasure.
Thanks so much for having me.
I hope you enjoyed this episode of You Must Be Some Kind of Therapist podcast. To check out my book recommendations, articles, wellness products, guest episodes on other podcasts, consulting services, and lots more, visit sometherapist.com or follow me on Twitter or Instagram at sometherapist. If you'd like to go deeper, join my community at somekindoftherapist.locals.com. Members can dialogue with other listeners, post questions for upcoming podcast guests to respond to, or ask questions for me to respond to in exclusive members-only Q&A live streams. To learn more about the gender crisis, watch our film, No Way Back, The Reality of Gender-Affirming Care at nowaybackfilm.com. Special thanks to Joey Pecoraro for our theme song, Half Awake. If you appreciate this podcast and want more people to find it, kindly take a moment to rate, review, like, comment, and share on your platforms of choice. Of course, just because I am some therapist doesn't mean I'm your therapist. This podcast is not a substitute for medical advice. If you need help, ask your doctor or browse your local therapists online. And whatever you do next, please take care of yourself. Eat well, sleep well, move your body, get outside, and tell someone you love them. You're worth it.